Hi, this is Randy Berlin again, and from Carmel, California, clinical psychologist. And I wanted to talk to you today briefly about addictions and to give you a bit of an example or two of what I think the essence of addictions are, and because there's a multitude of ways, many things, as probably many of you already know, to get yourself addicted to. So the way I'm thinking about addictions today are anything that you use to either avoid dealing with something that you don't want to deal with, such as, I don't want to do my work today, so I think I'll get on the internet and play some games, or I'll do something else. It's a distraction for me, so I can avoid doing what I need to be doing and ultimately waste a lot of time, or I can, use another technique, which is numbing. So that if I do something such as I'm feeling anxious or I'm feeling frightened or whatever it might be, anger, sadness, and maybe I want to numb it out with some drugs or with some alcohol or maybe some food. There's a number of things that we can use to numb ourselves. And so these are the two ways I'm thinking about addictions today. If you use something to distract or to avoid, or use something to numb out. And the purpose of it is to kind of confront the fact that this isn't inherently evil. So if I've got a lot of pain in my body and there's something that I need to help numb that pain slightly, then it's functional for me. If I happen to be thinking some very negative things and seem to be in some kind of a negative obsessional process in my head, I distract myself with something more positive. That's not evil. That's not a problem. The problem is if I'm using these techniques unconsciously for the most part, or as a way to keep from confronting the things in my life that I feel uncomfortable with or I don't feel comfortable dealing with. So one of the things that I find is that when people are trying to avoid, many times it has to do with conflict. So a kind of a simple example would be somebody says, would you please go take the trash out for me, or you please go do this activity for me, or you could, take care of something, pick up your clothes. And you said, yeah, I'll do it. And, an hour later, 5 hours later, 2 hours later, you still haven't done it. Or you say, yeah, I'm going to go take care of the yard, or I'm going to take care of the car, I'm going to do this other activity. When you say you're going to do it, when somebody asks you to do it, basically what you're doing is you're lying to them, because you're not really wanting to do these things, even though you say you will. What you're really wanting to do is to put them off and to get them to leave you alone for a while, or to avoid the conflict of saying, I don't want to do that. I'm not going to do that, in fact. And then you have a conflict. Then you have a disagreement. Then you may have some anger, hostility, whatever that you want to avoid. So you just tell people what they want to hear, or what you think they want to hear, just to get them to leave you alone and to avoid the conflict. The problem is those things accumulate, and then they breed resentments, and then later on people get angry at us, because we said we're going to do something, we haven't done it. And you may say that to yourself, such as maybe a New Year's resolution. You say, oh, I'm going to go lose a bunch of weight, or I'm going to go do these things, and then you don't do them, and then you end up feeling kind of sad, or maybe angry at yourself, or at least discouraged about your dishonesty. So addictions, one of the things it does is it helps us to avoid doing things or dealing with conflicts or other issues. And like I said before, numbing is another possibility, that you numb yourself out. And you can numb yourself out on work, intensity, you can numb yourself out on fantasy, you can numb yourself out on food, drugs, alcohol, as I said before. So the issue here is, are you using anything, whatever it may be, to avoid and or to numb? And if you are, then it's extremely important that you step back from that and start asking yourself the question and become conscious of the fact that rather than being dishonest to yourself or dishonest to someone else, it's extremely valuable for you to start to be more honest with yourself and be honest with others, saying, I'm not sure about that. Let me get back to you. Let me think about it for a while. Rather than just telling people what you think they want to hear immediately and then putting it off and avoiding it and ultimately then causing yourself some difficulties. So if you start to do this process and you start to become aware that you're avoiding, you can begin very simply by taking a few deep breaths and saying, okay, let me step back from this for just a moment and check in with my body, see if there's any distress, discomfort, anything I'm trying to avoid or numb out right now. And if there is, let me just breathe into it, notice what it is, and then decide what you want to do with it. So we can talk more about this in the future, but if you find yourself numbing or distracting, one of the things to do is just to check in with yourself and say, stop, let me breathe, let me notice what I'm doing, and let me just take some time to see if there's something going on in my body, some emotion, some distress, some discomfort, that needs to be addressed in some kind of way rather than just avoiding, because it just accumulates, it builds up, and it ultimately doesn't go anywhere. You just cover it up for a while. So it makes life so much easier if you just take care of things when they come up rather than putting them off. So thank you for today, and I'll talk to you soon.